going back to the roots of this whole organization, is access to care. If you look at homeless populations, if you look at undocumented people, if you look at working poor, access to care remains a major problem. Wellness is important. Keeping people out of the healthcare system is important. The predecessor of Alliance was a group that was brought together that included basically all people involved in healthcare delivery in the county, to everybody. Labor unions, third-party administrators, hospital and health system CEOs. And our CEO from UCSD attended the first group of meetings and then asked me to step in and be the representative from UCSD. Through the evolution of several different organizations that grew out of that, I've stayed on the board in one way or another ever since. Illness, disability, and poverty are a really bad combination. While there are a bunch of organizations that have tried to deal with each piecemeal, there have been very few places where you could get a broad view of how they impact the communities we care about. In its current iteration, the Alliance Healthcare Foundation is in a perfect place to do that, because we can look at a systematic approach to the problems and not be kind of hemmed in by the responsibilities of either a government or a large organization. We can take an independent view. The ability to bring new ways to looking at systems, we can help the people we care about, the poor, the ill. It's really kept me engaged. The thing that I find most interesting about the Alliance Healthcare Foundation is that it really takes into consideration the needs of the community, new ways of solving problems. Being a physician, my first thinking goes to sick people and trying to make them well. I always think about health as the absence of disease. Wellness, on the other hand, I view as preventing disease, or hopefully heading off things that can be prevented. It's a much more daunting task because behavior is such a big part of that. It's an important part of our mission in terms of looking for opportunities to prevent the healthcare problems that are so common in the populations we care about. Collaboration is important. No one group has enough money to deal with the kinds of ambitious missions that the foundation has, or the related foundations for that matter. Based on our funding expertise, we can fit in different parts of the puzzle. The board and the staff at Alliance are very focused on system approaches to the problems, to using new technology or old technology, or combinations of new technology or old technology. Remembering that when we say innovation, we're not talking about just technology. We can think outside of the box. We can also pull in ideas that more traditional agencies can't. So I think that it's the ability to go places where organizations can't go that makes us effective. You not only get a richer group of ideas, you get a literally financially richer group of resources to help support the missions of our various collaborators in our own foundation. It's a very active board, and there's a lot of different views expressed, and they tend to build a very strong case for whichever direction we go in our funding. Some projects succeed more than others, but that's the gamble of funding innovation. We work with the folks to whom we give money. We don't just send a check and walk away. We really continue to engage to try to meet the goals. Alliance brings together a unique group of individuals that spans all the way from very committed community healthcare providers to very innovative business people involved in technology relevant to health and wellness. It's a privilege to serve with such a group of bright people who have strong views. Out of those strong views, though, comes new ideas and new approaches. I don't think any board member comes out of a meeting with the same position they held going in. And that, to me, is a good group of people to work with.